Good whatever part of the day it is where you are. I have the honor of being the first speaker at this interesting symposium on digital health. The last months have shown how fast things can change in health and how fast digital meetings between patients and doctors could suddenly be realized. I am going to share some of my reflections on digital health. These are my conflict of interest. For me, one of the most important aspects of the patient-doctor relationship is trust, and my talk will mainly be directed at trust in a digital and non-digital health. Going forward in the digitization of care, a vision is the replacement of the doctor by algorithms, a digitalized system that gathers the information indicated and gives the solution to the problem. Basically, guidelines are a form of algorithm. They guide the doctor and patient to different questions and offer diagnosis, management, treatment, and prevention options. This is fine, as it guides the thinking and the questions we need to ask ourselves when deciding between doctor and patient what would be the next step forward. However, most of these guidelines are based on averages, on what is most common. I am a good example of where just looking at averages would not help. My severe asthma does not make me wheeze, and I very seldom cough. This has made my life and care quite difficult. Too many physicians followed the guidelines too strictly and told me I do not have asthma, did not know what to do with my treatment and care. This is where the doctors and patients' experience and intuition becomes important, and guidelines are there to guide us, but should not replace or take away from the knowledge and experience from patient and doctor about a specific patient's condition. Developing algorithms based on guidelines and research has the added problem that we do not know or understand the system behind it. This leads to many problems, as we have seen, for example, in the banking crisis in 2008. Nobody understood the algorithms, and they created a lot of problems and made the financial world shudder on its foundation. But even more importantly, nobody knew how to correct the consequences either. Trust and the process of evaluating and correcting is needed in algorithms used in care. In the past decades, the patient-doctor relationship has changed for the better. We are becoming more used to treatment options being discussed between patients and doctors, having a conversation about what the patient feels is going on, looking at both signs and symptoms. The relationship between doctor and patient is becoming more and more based on trust. I, as a patient, feel that I can trust my doctor with my most precious possession, my health, especially when it is already compromised by one or more conditions. Though there is nothing wrong with having a doctor-patient consultation via a digital system, trust is built better in face-to-face meetings. Nonverbal communication, which comprises around 80 to 90% of human communication, works better in a face-to-face meeting, and that helps to build trust. Even I, who am used to having digital TCs, find that there are issues I prefer with my doctor in a face-to-face meeting, especially when I'm worried. I'm not sure what's going on, when I feel something is not right, but don't know what. Recently, the Dutch Medical Board has reinforced the importance of intuition of both patients and carers when something is wrong. Exploring this is something best done face-to-face. It does not mean that we should only have face-to-face meetings or only digital meetings between doctors and patients. I was very happy during the COVID crisis that I could talk to my doctor through a video link, but I had things I kept to myself until I could have a face-to-face meeting. I hope I have given you some food for thoughts for the future. Thank you for your attention. I will be there for questions later in the session.